hyperglycemia medically. We need to know something about this disease. First of all, our body needs small amounts of lipids to work normally, to have energy. But lipids circulate in the bloodstream it means. Lipids are minimally soluble in water and majority transported into form lipoproteins. Lipoproteins make energy for our body. So there are also found types of lipids: triglycerides and cholesterol. Cholesterol is the most dangerous one. Lipoproteins can be classified according size or density. The larger and less dense lipoprotein consists of more fat than protein. And there are three types of lipoproteins: LDL type 1, LDL type 2, LDL type 3. Small LDL lipoprotein, but what's abbreviations? LDL, lipo density or low density lipoproteins called bad cholesterol. The meaning of apoproteins. Apoproteins is bind with lipoproteins to form apolipoproteins. According to the apoproteins, lipoprotein can be classified apo containing lipoprotein non-HDL. What about levels of healthy blood? And cholesterol should be 40 milligram and 150 milligram per deciliter. This national cholesterol test at least once every 5 years. Every 5 years you must check your cholesterol level. You did or no? Hyperglycemia, the presence of high level of primary hyperlipidemia, secondary hyperlipidemia. Classification of primary or what is etiology of hyperlipidemia? Hyperlipidemia from hypertensive or diabetics patient often have high cholesterol. A small medical condition can be cause raised level of cholesterol. This include kidney diseases or liver disease. Under supervision, cholesterol. Of cardiovascular disorder, disease or heart disease, coronary heart disease or hypertension. Atherosclerosis, that's mean slow complex disease typically start in childhood and often progress when people grow. It is responsible for this for 17 million people worldwide due to development of cardiovascular disease. Atherosclerosis etiology that happen due to damage of the arterial wall include elevated levels of cholesterol and triglycerides in the blood. This first cause. Second, high blood pressure, hypertension. Third, tobacco smoking. Fourth, diabetes. And maybe in eating. To diagnose high blood lipid cholesterol test. Blood cholesterol levels are measured with a simple blood test. Simple blood test used to determine the amount of LDL, low density lipoproteins, or bad cholesterol, and HDL, heavy density lipoprotein, good cholesterol, and triglycerides. The patient may be asked to not to eat for 10 until 12 hours before the cholesterol test. This ensures the food is completely digested and will not affect the outcome of the test. What guidelines in treating hyperlipidemia? NCEB, National Cholesterol Education Program, and the UK National Institute for the Health and Clinical Excellence Society, and ACC and AHA management guidelines recommend statin at first line therapy for prevention of atherosclerosis cardiovascular disease in adults. LDL, according to measurement of these standards, must be, it's called when 150 milligram per deciliter, 130 till 159 milligram per deciliter, borderline high, 129 milligram per deciliter, optimal, near optimal or above optimal. Less than 100. Okay. Lipid profile, LDL. The two types of treatment: lifestyle modification, prevention, have been published. Lifestyle modification changes are always important. Even the patient take medications to lower the risk. Changes can reduce cholesterol level by 15%. Second, maintaining a healthy weight. Third, be active on most, if not all, days of the week. Fourth, consumption. 6, increasing physical activity. We found like or phenofibrate action of these increasing sciences of lipoprotein lipase, that's mean analyze or decrease or break lipoprotein. Side effect combined with statin. This combination particularly should be avoided in elderly illness, especially chronic renal disease. Third, in those undergoing surgery. Fourth, patient receiving multiple medications. Avoid combination between vibrates and statins. Reduce total cholesterol by about 50 who have previous cardiovascular disease. Improve quality of life. Statin by HMG CoA reductase inhibitors. Statins are a group of medicines that can help low to decrease the level of low density lipoproteins LDL cholesterol in the blood and reduce the production of it inside the liver. That's mean make a control about fatty liver. Also, adverse effect, although side effect can vary between different statins, common side effect which affect 1 in 10 people include epistaxis, sore throat, headache, constipation, diarrhea, and this is also recorded. What about examples of statins? Atorvastatins, fuvastatins, lovastatins, pitavastatins, bravastatin, simvastatin, rosuvastatin. What? Rosuvastatin. Rosuvastatin is reductase inhibitor. Improve endothelial function reduction of oxygen derived from free radicals. This return to reduce endothelial dysfunction that have been implicated in atherosclerosis. That's mean control about atherosclerosis. Also, rosuvastatin reduce high sensitivity C creatine protein, which is maker of inflammation and independent cardiovascular predicator and other inflammatory makers. Also, rosuvastatin inhibits platelet aggregation to leukocytes, which inhibit formation of clots in injured endothelium. Pharmacokinetics. What happens in this pharmacodynamics? That's mean effect in body. Pharmacokinetics, that's mean measurements and the intrinsic of this molecule. Human hepatocytes studies indicate rosuvastatin is poor statin for metabolism by cytochrome B450, and hence 90% of the drug is excreted and changed. Rosuvastatin also is metabolized to an N-desmethyl metabolite, which is less potent than activity. Approximately 90% of rosuvastatin is protein bound, mainly to albumin or other percentage protein binding. Rosuvastatin is less lipophilic than other statins, such as atorvastatin, simvastatin, simvastatin. Rosuvastatin penetration into extrahepatic tissues occurs by passive diffusion and is dependent on their lipophilicity. This has implications on their muscle safety, as increased rhabdomyolysis was reported in patients on lipophilic agents like simvastatin. What about dosage of (5 to 40 milligram once per daily according FDA labeled dosage? That's mean once daily, but recommended from 5 to 20 milligram once daily. That's is Rosuvastatin and cholesterol. Please subscribe, press bell, like, share and comment, and see you in next video on this channel in every fields. God bless you.